some states tend to have more cases of healthcare fraud than others, and there appears to be a correlation between the monetary value of healthcare in a state and the amount of fraud that occurs. Florida is one such state where the correlation seems to exist. To put the scale of Florida's healthcare into perspective, the state's home healthcare industry clocks at $6.2 billion. But what does healthcare fraud look like in this state? Hi everyone, I'm Elia from eTactics, and today I'm going to discuss an infamous example of healthcare fraud in Florida. Before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. Also, hit that alert bell icon so when we post new helpful content, you get notified. Michael Ligotti was a medical director for over 50 addiction treatment facilities, also known as sober homes, in Palm Beach County, Florida. He practiced as a doctor of osteopathic medicine. Ligotti ended up pleading guilty to committing healthcare fraud in October of 2022. As a result, the courts ordered him to suspend his medical license. So what did he do, and what was the healthcare fraud scheme? Ligotti owned a company called Whole Health LLC. This company provided treatment and testing to substance abuse patients. As I mentioned before, Ligotti was a medical director of many sober homes. Because of the potential conflict of interest, Ligotti allegedly conspired using a quid pro quo scheme. As the director, the doctor gave standing orders which authorized staff in sober homes to perform testing. The staff would then bill the insurers for the tests. In return, Ligotti received access to a steady supply of patients from the homes to his LLC. The clinic would then conduct unnecessary and expensive testing on referred patients and bill their insurance for tests. Some of these tests cost more than $26,000. In total, this Florida doctor charged healthcare benefit programs and insurance companies approximately $764 million from 2011 to 2020. He took $127 million just for himself. A Florida judge sentenced him to 20 years in prison as punishments. In this healthcare fraud example, the doctor was billing for unnecessary medical services to fraudulently inflate insurance payments. This form of billing is a subcategory of unbundling, since the doctor is submitting more expensive services that aren't needed. Inaccurate claims for procedures that took place can increase reimbursement. This example of a scheme also includes the kickback form of healthcare fraud. The doctor agreed to do something of value for sober homes in exchange for patients. In other words, the doctor agreed to do something that would help the addiction treatment facilities make superficial profits in exchange for him making more money at his LLC. If you'd like to learn more about healthcare fraud and healthcare compliance, reach out to eTactics. And you've already made it this far into the video, so you might as well like it, share it, and comment below.